today I'm going to be teaching you how to clean a G-tube site. Here's some of the things that you're going to be needing. The first thing that we need is some sort of bottle. I'm using a Medela bottle that I'm going to be adding some sterile water to and mixing in just a little bit of baby soap or baby shampoo. Then we're also going to need the paper tape again. We're going to need 2 2x2 split gauze, which is just a gauze with a split down the center. If you don't have a split 2x2 gauze, you can get some regular 2x2 gauze and cut it down the center yourself. Then we're going to need some cotton tip applicators, and some people like to use a Tegederm to hold down the tube to the skin. I used to use this, but I find that it irritates my daughter's skin, so I like to do it a different way, and I'll show you how. Now that we have everything we want, let's get started. Alright, so I've opened my bottle. I'm going to add a little bit of this sterile water. I got this through our medical company, and they supply sterile water. So this is a great option to get nice clean water from your company. So we add that, and I'm going to add a little bit of baby soap to it. Just a drop will do. Perfect. Now I'm just going to mix this up. Perfect. Alright, this is my daughter's G-tube. This part of the G-tube is called the hub. This is the feeding port and the med port. The hub can be replaced without anesthesia if it gets clogged or there's any problems with it. This part can be snipped off and a new hub can be reattached. This part is called a clamp, where we open and close before we add any food, water, or medicine into the hub. And this is where the G-tube enters into the stomach. We got our G-tube through interventional radiology, which is the latest technique that they have other than surgery, and there's one incision that's made, and then the tube is passed endoscopically and then pulled out through the stomach. This part is a stoma. This is what we have to make sure that doesn't develop any granulation tissue or does not get any infections. Alright, that's a little bit about the G-tube. Now let's get our solution ready and go from there. Alright, the first thing that we're going to do is we're going to open our cotton tip applicator. There's 2 that come in here. We're going to take one of the cotton tip applicators, and then we're going to dip it into our soapy solution. We're going to go in circular motions around the opening, like this. Make sure you go and clean every crust off or anything that's there. Just clean as much as you possibly can. Also make sure you rotate this once a day, just so that it doesn't stick. Okay, once that's done, we're going to take the other cotton tip applicator, and we're going to dip it in the sterile water and just give it a little rinse. Same thing, circular motions, just clean the area as much and as well as you can. Alright, now I'm going to take one of the 2x2 gauze, and I am going to go over the area like this just to dry off as much as I possibly can before going in with the 2x2 gauze, because you want to make sure that the area is nice and dry before covering it up. Okay, now I'm just going to wrap it up with the split gauze, just like this. I'm going to take a little bit of the paper tape, and I am going to just hold it down like this. The paper tape, we use the paper tape because it's easier to pull off when you need to wash it again. Now, that's all you need to do. And then what I like to do after this is, some people like to use the Tegederm, which is just like, it's a large clear tape where you would normally just tape the G-tube to the skin so it stays out of the way. But what I like to do is just take the G-tube and put it in her diaper just like this, and it stays out of the way and you don't have to worry about it, and it's that simple, guys. I hope you enjoyed this video and you found it helpful. If you did, please subscribe, like the video, comment down below, and let me know if there's any other videos that you'd like to see. Thank you. I'll see you on the next one.